Okay, good day nurses. For today's discussion, we will talk about frail chest. Okay, so frail chest, ano ito? Isa siyang halimbawa ng chest injury. Okay, isa siyang halimbawa ng chest injury. And according to your book, it is life-threatening. It is a life-threatening chest injury. Na kapag hindi ito naagapan ng promptly, hindi ito naagapan immediately, it can lead to what? To respiratory failure. Okay. By definition, it is a complication of chest trauma. Kaya nga nang sinabi ko kanina, isa siyang halimbawa ng chest injury occurring when 3 or more adjacent ribs are fractured at 2 or more sites resulting in a free floating ribs. Parang nandito sa ating illustration. Okay, sabi kanina, there are 3 or more adjacent ribs that is fractured. Okay, then each rib is broken into 2 or more places. Okay? So, yung portion ng chest wall natin, it becomes detached from the rest of our thoracic cage. Okay? So, ngayon, yung detached portion nito, tinatawag na siyang what? Frail segment. Or yung sinabi ko kanina na free-floating rib segment. Okay? Now, para maintindihan natin si frail chest, let's talk about the normal chest wall. Anong nangyayari sa ating chest wall when we inhale and exhale? Okay, so unahin natin yung ating pag-inhale or our inspiration. Okay, di ba? During inspiration, ano yung nagko-contract sa atin? Our diaphragm contracts. Yes or no? Yes. Okay, then this one, the external intercostal muscles also contracts kasi nag-i-inhale tayo. And when we inhale, gagawin mo, our ribs will elevate, tataas. Then our chest cavity will expand. Okay? Nag-e-expand yan. Then, what keeps our lungs inflated? Due to what? The negative pressure. So, yun na, negative, papasok na si negative negative intrathoracic pressure para mag-expand yung lungs natin. Then, yung air or your oxygen pupunta na sa ating lungs. Yan ang nangyayari sa ating chest wall during inspiration or when we inhale. How about when we exhale? Okay, nangyayari when we exhale or expiration. So, kanina, nag-contract lahat, alas nag-contract lahat. Ngayon, ano namang mangyayari? Magre-relax, okay? Then, our respiratory muscle, okay? Ano bang respiratory muscle natin? Our diaphragm, okay? Our respiratory muscle will relax, okay? It will relax. Now, anong mangyayari sa chest wall? It will recoil. Hindi ko mabigkas. Okay, it will recoil inward. Then, the air or the oxygen will move out. Okay? Yun yung nangyayari. Okay? Kapag ginawa mo yon ngayon, you inhale and exhale, you will notice that your entire chest wall, okay, moves together. Diba? It moves together. Okay? Parang isa silang solid unit na gumagalaw rhythmically and solid yung galaw nila. Okay? Ano naman mangyayari kapag meron kang frail chest? Anong mangyayari? Okay? Instead na move sila together, anong mangyayari sa may portion ng may frail? Anong mangyayari? Mag-iiba ang movement. Okay, the fracture segment, this fracture segment will now move independently. Okay, independent na siya, hindi na siya sasabay sa iba. Okay, this will cause instability of the chest wall. Okay, the chest wall is, okay, fracture of several ribs and resultant of instability of the affected chest wall. Okay? The chest wall is no longer able to provide a bony structure necessary to maintain adequate ventilation. Consequently, the frail portion and underlying tissue moves paradoxically. When we say paradoxically, meaning it is opposite to the rest of the chest cage and the lungs. Then the frail portion is sucked in on inspiration and it bulges out on expiration. Anong tawag dyan? That's what we call your paradoxical respiration or your paradoxical chest movement. Bakit nangyayari yan sa frail chest? Okay? Bakit siya nagmo-move in opposite? Okay. Di ba sabi natin kanina, normally, dapat when we inhale, dapat nagmo-move sila together. Pero dito, sa frail chest, kapag may frail chest ka, the frail segment will move independently. Okay? Now, imagine na naman natin kapag merong frail chest si patient. Okay, anong nangyayari? Normally, our diaphragm contracts. Intrathoracic pressure becomes negative kasi yung negative pressure na yun yung mag-expand sa ating lungs. Okay? The negative pressure will pull the air into the lungs para mag-expand siya. But because meron tayong frail segment na na-detach, di ba, mag-move siya independently. So, anong mangyayari? The negative pressure in this part will also pull the loose rib segment inward, like this one. Okay? Instead na mag-expound siya outward, it gets sucked inward. Okay? Meanwhile, the rest of the chest expand normally. Yung frail chest siya na-suck inward. Okay? Then, kapag nag-expire na, nag-exhale na si patient, yung frail segment, it moves, outward. Okay? This is called your paradoxical movement. Okay? The chest is pulled inward during inspiration, reducing the amount of air that can be drawn into the lungs. And the chest bulges outward during expiration because the intrathoracic pressure exceeds the atmospheric pressure. The patient has impaired exhalation. Oh, alam mo, bakit may impaired exhalation na si patient? Ano na bang nangyari sa kanya? O dahil may frail chest si patient, anong mangyayari as a clinical consequence? Okay? As the chest cannot expand completely, ibig sabihin lang yan guys, less na ang air or oxygen na papasok sa kanyang lungs. Okay? O dahil less na ang oxygen na pumapasok sa kanyang lungs, imaginein mo ano yung mga clinical consequences na mangyayari kay patient. Ibig sabihin ba magde-decrease lahat? Okay, magde-decrease ang kanyang tidal volume. Ano pa? Ano pang pwede mag-decrease sa kanya? Yung alveolar ventilation niya, and it will also decrease the oxygenation of the patient. Okay? Now, kung decrease lahat yan, anong pwedeng mangyari kay patient as a clinical manifestation? Okay? The patient begins to develop what? Hypoxemia. Okay, na-imagine na guys kung paano siya nangyayari, bakit siya nagli-lead into a respiratory failure. Kasi kanina, di ba, during our introduction, sinabi ko na it is a life-threatening event that kapag hindi siya naagapan immediately and promptly, it will lead to what? Respiratory failure. Okay, nagigets na siya guys? Okay, very good. Bakit siya life-threatening? Bakit? Ano bang pinaka-dangerous nito? Okay, bakit? Okay, tanungin mo yung sarili mo guys. Okay, kung na-fracture lang yung ribs mo, kung na-fractured yung mga ribs mo, okay, ribs, okay, pag fractured rib kasi isang rib lang yung na-fractured. Kapag frail chest, madaming rib ang na-fracture, okay? So, pag na-fracture yung ribs mo, okay, fractured ribs, okay, allow me to rephrase that again, okay? When you have frail chest, okay, makakapag-breathe ka pa ba normally? Definitely no. Because our breathing is, nakadepende kung gaano ka-stable ang ating chest wall. Diba? Sabi ko kanina, like, nandiyan. According to the definition of your Brunner, kadepende yung ating breathing sa kung gaano ka-stable ang ating chest wall. Okay? Because our ribs, okay, in anatomy of physiology, our ribs or our bones, it acts like a what? Like a rigid framework. Okay? Na kapag nag-collapse yan, ibig sabihin lang yan, our lungs cannot expand efficiently. And dahil alam mo na our breathing depends on the nakadepende kung gaano ka-stable ang ating chest wall. Okay, ano pa ang other problem nito? Bakit siya dangerous and life-threatening? Okay, imagine guys, anong nakikita nyo dyan? What is this part? May pasa. Nagkapasa na yung lungs niya. Okay, that's your pulmonary contusion. Okay, that's your pulmonary contusion. Nagka-bruise, nagkapasa sa lungs niya, sa loob kaagad due to blunt trauma. Okay, blunt trauma. Hindi siya penetrating trauma, blunt trauma. Okay, magkakaroon ng bruises on your lungs. Yes, sa lungs na. Kapag may bruises dyan, may inflammation na nangyayari. Anong mangyayari sa lungs mo? Okay, the blood and other what do you call this one? Inflammatory mediators and chemical mediators will leak, other fluids will leak into your lungs. Okay, saan sila pupunta? Sa inyong alveoli. Okay, kapag yung alveoli mo napuno ng fluid instead of air, anong mangyayari? Okay, syempre, nade-decrease ang what? Ang gas exchange. Magkakaroon ng what? Poor ventilation and poor oxygenation si patient. O, na-imagine nyo na guys, kung anong mangyayari, bakit siya life-threatening. Na kapag hindi naagapan, it will lead to respiratory failure. Okay? Dahil alam mo na, what are the clinical manifestations? We have here severe dyspnea, difficulty breathing, severe, rapid, shallow, grantly breathing, diminished breath sound. Okay, ano pa? The patient will move, the chest will move inwards on inhalation and outwards on exhalation. This is known as your paradoxical respiration. It is the hallmark sign of your chest frail. Again, it is a hallmark sign of your frail chest and severe chest pain. Bakit? May pain, okay? Okay. Every breath na ginagawa ni patient, okay, it causes what? Pain. Okay? Ngayon, si patient, dahil may pain na siyang nararamdaman nag-i-inhale siya, ang gagawin niya, swallow niya yung breathing niya. Shallow na lang due to severe pain. Okay? Then, we move on to medical management. Okay? Ang medical management nito is mainly supportive. Bakit? Okay, because our ribs heals on their own. Okay? So, yung goal lang dito, ang management, ang goal natin is to keep the patient alive to prevent respiratory failure. Okay? So, we provide ventilatory support. So, airway, ang priority natin dito. Number 1 is airway. Then, clearing secretions from the lungs and controlling pain. Kasi nga, di ba, may pain na nararamdaman si patient dito. Then, specific management depends on the degree of respiratory dysfunction. Okay? If only a small segment of chest involved, anong gagawin? We clear the airway through positioning, coughing, deep breathing, and suctioning of secretions. Okay? Then we relieve pain by intercostal nerve blocks. Okay? Ano pa? High thoracic epidural blocks, or we cautious in using IV opioids. Kasi you know naman that opioids can also depress your respiration. So, cautious tayo sa paggamit niyan. Okay? And kapag mild to moderate flail chest ang injury naman ni patient, anong ginagawa natin? We monitor for fluid intake, then appropriate fluid replacement while relieving the chest pain. Okay? Then, pulmonary physiotherapy focusing on lung volume expansion. Then, secretion management techniques. Then, we monitor for further respiratory compromise. And if severe naman yung frail chest niya, we need to have a endotracheal intubation and also the use of mechanical ventilation. These are required to provide internal pneumatic stabilization of the frail chest and to correct abnormalities in gas exchange. So, mag-PT at mag-mech vent muna si patient para matulungan natin yung kanyang respiration while nag-heal yung kanyang ribs. Okay? This help to treat the underlying pulmonary contusion. It also serve to stabilize the thoracic cage to allow the fracture to heal and improve alveolar ventilation and intrathoracic volume by decreasing the work of breathing. So, yung machine muna talaga ang tutulong kay patient para makahinga siya while hinihintay natin na mag-heal ang kanyang mga ribs. Okay? Then, rib-specific system may be used for 3 or more rib fracture or frail chest in order to achieve chest wall stabilization. Okay? Your CWS meaning chest wall stabilization. It is inserted preferably within the first 72 hours of injury. The benefits of this one is to decrease the bleeding, less inflammation, and reduce chest wall deformities. Okay, you can access this on your medical surgical book, okay, by Bruners and Sudart. That's all for your frail chest. I hope you learned something.